Today on Health with Patricia, we are talking UTI, urinary tract infection. It's a bacterial infection that affects lots of people. I believe you have been infected, or let's say you have been a victim. Today we want to understand, but this time around I want to be a bit biased. We want to just talk about the women, because women are at higher risk of getting UTI, and we want to find out how can we prevent it? How can we, is it possible that we can be free from UTI for the rest of our lives, or as a woman you have to manage it? I don't know, but we need to get that understanding. And my guest today is Dr. Vanessa Mensah-Kabu, and she's going to give us all the education we need, the personal hygiene. I know you already have on your personal hygiene. You've prioritized your personal hygiene, but you're still getting recurrent UTI. Today we'll find out why, and maybe there are one or two things you're not doing right. So please stay tuned. It's always Health with Patricia. With me, Patricia Roxanne Hammond. Hi.
Hi, Patricia.
Don't you think this UTI is not being fair to the women?
I mean, if you put it that way.
I just don't understand, because you do everything. Personal hygiene, you're ironing your panties, you're changing your underwears. You go to the washroom. You know, in my washroom, do you know what we do?
Tell me.
Like office setting. So anytime you buy a tissue, you put in the washroom, within 2-3 days it's finished.
Oh.
Or even no, that same day, because you get a lot of women taking longer rows
Just to
cover the seats, even within, just so, but still, what's happening?
Well, Patricia, like you rightly said in the intro, urinary tract infection simply is bacterial infection of the urinary tract, the kidneys, the bladder, and the urethra. Unfortunately for us women, our physiology is not too good to us in the sense that our urethra is much shorter than that of the men, and that is the reason why we as women are more at risk of getting a urinary tract infection as compared to the men. And it's also one of the reasons why we keep getting recurrent urinary tract infections. Yes. So it's simply because of the mere fact that our urethra is shorter.
So in this case, how, because I know taking too much antibiotics is not right.
Yes.
But the only solution here is antibiotics.
Well, I wouldn't say the only solution here is antibiotics.
Okay, so I stand to be corrected on this particular one.
So it depends. Usually. So one of the key things that we tend to recommend to our clients or patients is that once you notice anything unusual, visit your healthcare provider, have the right investigations done, and then you are started on the right antibiotic. We have this culture where once we suspect anything, we run quickly to the pharmacy and then ask for an antibiotic, and it's given to us. But antibiotics are prescription medications. They should not be given out, or a person should not be given an antibiotic or request an antibiotic unless they have a prescription.
And no, most people think going to the hospital is like a long process.
I agree.
And they have to spend. So instead of spending so much, just go to the pharmacy. To the pharmacist, I feel the sharp pain when I pee. So
and
just
so
give me something.
I completely agree. Going to the hospital can be a little cumbersome, and it can be a little stressful for the individual. But if you look at it this way, each time you have something wrong with you or you experience a symptom, you rush to the pharmacy, you get a medication, you keep going back and forth, back and forth. In the long run, the effects on you as an individual is going to be much more grave than just going to the hospital that one time and getting the right medication prescribed for you.
Okay.
Yes, we're looking at antibiotic resistance, which is one of the things that we struggle with, especially in the hospitals, because a patient comes in and it's almost as if we're not sure of what antibiotic to give to the person, because everything shows resistant. And that complicates things, not just for the individual who comes with the signs and symptoms or the disease, but also for the doctor, because it can get frustrating. Because now you have to look at higher medications, you have to now start looking at other alternatives, which are to an extent very difficult to find. So it's always better to just visit your healthcare provider immediately you notice anything unusual with your body. Now, back to the topic of urinary tract infections. It's a bacterial infection that affects the urinary tract, the kidneys, bladder, and the urethra. Yeah. So once you're diagnosed with a urinary tract infection, the next line would be that you would be started on antibiotic based on the clinical presentation of the patient. Okay. There are some patients that we do conservative management, meaning that we encourage them to hydrate more, and some of the lifestyle things that may predispose them, such as not washing properly after you've urinated or using the wrong products to wash. We as women, I know there's so many feminine hygiene products on the market, and it's very tempting to just pick this, pick that,
because it's very tempting. Maybe Sister A used it and she feels, it makes me feel clean, dry, so you should also try it. And I think it's becoming too much on the market. Everyone is selling vagina wash, and I don't know. Yes, because I know it's for a good cause. Nobody decides to go get this feminine wash thing to just damage the system. They just want to feel good because of this recurrent infections.
Exactly, and rightly so. These products are on the market to help us or to assist us maintain a certain level of feminine hygiene. However, overuse or indiscriminate use is where lies the problem. Okay. Because the vagina in its own way is self-cleaning, and so very little goes a long way to help preserve the bacteria, the good bacteria in there. And so using different things every now and then only ruins or creates an imbalance in that area, predisposing you or putting you even at risk of getting this recurrent candidiasis, all these feminine issues that women suffer with. Okay. So these products are good, but the indiscriminate use of these products is what causes these issues. Okay. So just a simple non-scented soap. Sometimes we don't even recommend soap. Just some water just to wash the area is good enough for the vagina. And if you notice anything unusual, please visit your healthcare provider just so that the proper tests are done and the right medications are given to you where necessary. We have this belief that once you visit the hospital, you have to leave with medication. And so sometimes you go see your doctor and the doctor says that, okay, do A, B, C, and D, and the doctor does not give you medication. Yeah. And then you are left feeling like, so why did I go to the hospital if the doctor did not give me any medication? And so it's rather unfortunate, but sometimes patients don't need medications. They just need a little tweak in their lifestyle, and that is just all they need to be healthy and to feel good.
So now let's talk about how, as women, what can we do to prevent this recurrent UTIs? So apart from maybe coming to the hospital for the antibiotics and other things, what are some of the things we need to do?
Some of the things that we women can do in our own little way to help reduce our risk of urinary tract infection is simply rehydration. Hydrate lots frequently. Don't wait until you're thirsty before you hydrate. Okay. Also, don't keep your urine in for too long. I know sometimes you might be somewhere and you just want to hold that urine in for a long period of time, but that puts you at risk of developing a urinary tract infection because that urine is only going to stay there. Okay. And it's going to just form stasis and then can cause or put you at risk of urinary tract infection. Okay. Also, the indiscriminate use of certain products, the washes, the vaginal douches, these things can also predispose you to getting urinary tract infection. And then how you clean is also very important. We clean from the top back, not from the back to the front. So it's very important that you clean from the front, back, and not the other way around. Those are little things that we tend to miss that would put us at risk of urinary tract infection. So once we pay attention to these little things, we can help reduce significantly our risk of recurrent urinary tract infections.
Is it possible that you clean from the front to the back and you realize that no, the back is still not clean enough? Because I think you mentioned in one of the interviews that I watched, you mentioned that you should wash the place after? So as a woman, am I supposed to carry water to the washroom?
Well, the ideal thing would be to wash, but definitely the access to water, clean water, might also pose a challenge. So you can always carry these feminine wipes. They have little plain wipes that can be carried, and then you can just use that to clean. Or a simple dab with tissue is good enough.
Okay. So let's talk about, before we get to pregnancy, let's talk about sex. Does it affect women in any way? Like, is it having multiple sexual partners, or even maybe your partner? Are you at risk of getting UTI?
Well,
or when it comes to sex, it's just maybe the vagina itchiness and all that?
Well, sex in its own has its own areas that we can discuss at another time.
Okay.
But we've been advised that it would help significantly if we use the washroom, that is urinate, immediately after sexual intercourse.
Okay.
Yes, that has been advised or has been put out there that it tends to help reduce the risk of urinary tract infection.
What if you do not have the urge to wee-wee?
That also, not necessarily, but if you can, that's good. But if you can't, don't force yourself to do that.
Okay.
Yes. And then also, having multiple sexual partners besides, that also poses a risk, a totally different risk of sexually transmitted diseases, and I'm sure that we can discuss at another time.
Okay.
Yeah.
Okay. So let's come to the pregnant women, because as the baby, the fetus, yes, it's put so much pressure on the bladder, and you tend to wee
more frequently.
Yeah.
Well, pregnancy in its own comes with its own complications, various complications. One of the high-risk individuals for urinary tract infection is actually pregnant women. So pregnant women are more at risk of developing urinary tract infections. And the treatment for urinary tract infection for pregnant women differs significantly
from someone who is not pregnant.
Exactly, because we are trying to conserve the growing fetus as well as looking at the clinical state of the mother and what is best for her in that moment. So we're not going to be pumping mother with antibiotics with every urinary tract infection she gets. The gestational period for a pregnancy is 40 weeks. So imagine if every 4 weeks you're having a urinary tract infection, that's going to be about 10 antibiotics that will be given to you during that course. So it's mostly done in a holistic way, whereby we look at the person's clinical state, the level of infection, and then also the bacteria that is causing their infection, and we treat accordingly.
Let's look at some of the symptoms of the UTI, apart from the sharp pain you feel when you go and urinate. What are some of the things we should look out for, the warning signs that we need to rush to see the doctor, or to come to even to...
So, dysuria, that's the sharp pain that is usually felt either during urination or after urination, is one of the significant pointing signs to a urinary tract infection. Besides that, there's also the abdominal discomfort or pain in the pelvic region, the lower abdomen. There is also urine frequency, where a person tends to urinate more frequently than usual. And that is in the absence of maybe the person drinking so much water, because naturally, once you drink lots of water, you tend to urinate more frequently. And then also other symptoms include nausea, vomiting, feeling feverish. These are... Should
I say that is at is it the worst day, when it gets worse?
Not necessarily, because they can interchange. Some people might not have the dysuria or the painful urination, but may have nausea or the fever or the abdominal pain. Some people will just have frequent urination, and that would be significant. So depending, we as individuals have different ways of dealing with infections in our bodies. We also have to look at underlying health conditions that would probably predispose someone to getting more signs and symptoms as compared to someone else.
Someone also confided in me about getting like peeing blood, like she saw blood in her wee-wee, like after wiping. and she was alarmed, so I advised her to go to the hospital because she thought
that was very good of you.
Yeah.
That was very good of you. I mean, once we know our body's hematuria, that's blood in the urine, can also point to a urinary tract infection. These symptoms are not exclusive to urinary tract infection, which is why we always recommend that once you notice anything unusual, visit your healthcare provider so that the right investigations will be done and the right medications and management will be given to you. Okay.
So what are the effects like for, should I say uncompleted or is not treated properly?
Incomplete treatment.
Yes. You know, you said, you mentioned that antibiotic resistance. Yes. So what happens? Does it climb up to go and affect?
Yes.
What, like,
so
how,
some of the
or let's just generalize it. How dangerous is UTI?
It's very dangerous when left to explore. I like to use that word, explore, meaning that when left untreated, it's very dangerous, meaning that you give the bacteria free range to do whatever it wants with your body. So once there is an infection in your system, if left untreated, it could move further. Some people, or naturally, the body's own self-defenses tend to fight these bacteria or pathogens that are found in the bodies, like a foreign body or a foreign substance in the body. The body's own defenses will be put up to fight it. But then when it becomes overwhelming for the body, that's when the symptoms and then the signs start to show. So once you start getting these things, if still you leave them untreated, then it could get worse. You could put yourself at risk of kidney infections. That's the acute kidney infections or a chronic kidney infection. You could also put yourself at risk of sepsis. That is infection of the blood. You could also put yourself at risk of, for the pregnant women, you could put yourself at risk of preterm delivery or early delivery, and that is not healthy. And you could also get recurrent
to all the organs.
Exactly. You could get recurrent infections, which would become difficult to treat. So it's important that, once you know your body as an individual, you know what is going right, and at every stage, you know what may be going wrong. And once you notice anything unusual, please visit your healthcare provider, however little it is.
So what my friend told me was when she got to the hospital, immediately they had to put
an IV line?
I think was it Rosaphane or something?
Rosaphane.
Once more, they had to. And she asked the doctor why, because I thought it was just a normal infection. He said, no, you need this first before you start.
Yes. So yes, that is the gravity of bacteria in the body, unwanted bacteria in the body. So once it's left untreated, it could move further, causing the septicemia or the sepsis, like I mentioned, grave or chronic urinary tract infection, or the kidney infection, which may be what was happening with your friend. So once you visit your healthcare provider, depending on the presenting complaint, the clinical outlook of the patient, and the investigations that are done. These are the three things that we do to ensure the right management, the right diagnosis is made, and then the treatment is started.
Because in a space where there are lots of women, you realize that lots of them are having UTI, even though they are prioritizing their personal hygiene and all.
That's true, because there are several other, bacteria moves around. She gets it. So they could be having an underlying health condition. There could be several factors that would put you at risk of getting a UTI.
So as Dr. Vanessa mentioned or recommended, anytime you notice something unusual, please visit the hospital. So I want to give her the opportunity to the final words to the women.
Well, thank you so much, Patricia, and I believe you're doing very wonderful and in trying to create some education on health is very important. I personally believe that healthcare is all about prevention and not curative, but we have this belief where you only go to the hospital when there's something wrong. Ideally, you should be going to the hospital routinely and frequently, just so that things can be picked up.
When you say frequently, like
how often?
How often,
So ideally, depending on the stage you find yourself, it's either annually, biannually, or maybe every 2 years. And
Okay,
as
okay.
women, we have several screenings that we need to do. The cervical, breast cancer, all of these things come into play.
Okay.
So yes, as women, it's important that we have a doctor that attends to us, and don't shy away from the hospital. Visit your healthcare provider as often as possible. You know your body's best, and you are the only one that'll be able to say, this is wrong with me, this is wrong with me. So once you notice anything unusual, please visit your healthcare provider, and the right tests will be done for you, the right diagnosis will be given, and the right treatment would also be given. So thank you so much, Patricia.
Thank you, thank you, thank you, thank you. I'm so grateful. So my guest has been Dr. Vanessa Mensah Kabu. I forgot to mention your hospital. So just in case someone needs a personal, like a one-on-one.
So yes, thank you. So I work with West African Rescue Association.
Okay.
It's for registered members only. So if you would like to register with our clinic, you can always visit our website.
Okay.
And you can always register. We're open to registration, and we're happy to attend to anybody that registers with us.
Okay. So the show has been held at Patricia with me, Patricia Roxanne Hammond. At the same time next week, please stay blessed.